can go higher in my opinion. But really, that should, excuse me, that should be a total of, say 70 plus, or 50 plus 22, which is 72,000. And that is consistent with what you just said, that the village pays Riverside 70 or 72,000. So I think that we should be.
If we remove those numbers, that would actually make my budget for 2025 a little smaller than what it's showing there.
Correct.
Okay.
Mr. Mullen, we have that for later.
I just wanna make sure that
Amy,
we're all
sorry,
well,
Amy,
oh, sorry, Andrea Lurch, 2022 Circle Drive, Kronenwetter. And I just wanna make sure that we're not rushing. Do I believe that all of the first responders for Kronenwetter know and are trained and care and are gonna call paramedics as soon as they can? Absolutely. I've worked with them, I've worked at Safer, I've worked on Riverside. I've trained a lot of them. I absolutely believe that. I just wanna make sure, I came here to gather information tonight, that's all I came for, but I wanna make sure that we don't move too fast. I wanna make sure if we say we're an AEMT, that we're gonna be successful in that, and that we have the staffing. And I know Mosney had to downgrade, that's my biggest concern. I don't want us to go in saying we're gonna be AEMT, and then not have the staffing to keep that, and have to downgrade, and people say, told you you were gonna fail. You know, and I wanna just be very fair with that. There's a lot of things that people don't understand until they're in the service, and I think that us going to a forum and taking our time to be informed is gonna be our best bet. Pro or con, we have to take our time on it.
I agree. I will make one comment. Mosney is currently an AEMT flex, or EMT basic, flex to AEMT.
Flex.
Yep.
Flex to AEMT.
And they are working on getting their AEMT license back.
You know, obviously this is a really heated item for the village, and I don't think there has been enough information shared with the village. And true transparency, I didn't even know we were looking for an ambulance service until I got into this position. I think it would behoove us to share more information with the village, because my short experience being here is that there's always a small core group of village people that come to these meetings, and we don't hear everyone. And going back to the social media part that Chris had mentioned, I agree too. I don't partake in social media, and it's just unfortunate that there's a lot of keyboard warriors, like he had mentioned too, and individuals that are more likely to say something on Facebook or on Nextdoor than actually come to your face and say that too. So I would be in support of making a motion that we would go ahead and have a public hearing special. And no disrespect to anything, I think you put a lot of work on this proposal.
That's why I included that as the recommendation.
Yeah.
And I would too, I've been a proponent this whole time of having a public forum on this and delaying it, not rushing this. And there's a lot of research that has been done. I've done my own research separately, and I'm not going to use this to go through everything. But, you know, there are some areas, myself, I'd like to see it addressed. You know, it's the risk factors, as, you know, Chris Iden was saying, looking at this, that's the part I want to be able to quantify with it, right? This is an essential service, it's life or death for a lot of people. So you need to understand all the risk factors. Some of the biggest risks are in the staffing, in my opinion. Right, this proposal is made with the assumption we're only using part-time EMS people, correct? You know, Riverside and some of the others, I think Riverside has 6 full-time EMS.
The rest of them are part-time.
The dividing line is 1,200 hours a year. At 1,200 hours a year, you automatically,
Correct.
that puts you automatically into the WRS. So that means full protective services pension.
14% of your wages.
That is at full pay, so on-call pay does not go towards that.
Right. But like getting all those, well, tracking the staff to be able to juggle all those hours, I mean, that's gonna be, that will be a clerical scheduling headache, for sure.
Fully with.
And, you know, it really only takes a slip up once, and then you're paying all these benefits, and the full cost of an EMT at full-time, I calculated out at $20 an hour base pay to be about $68,000 a year. So that's a big bite And
That's,
it's basically
say that number again. so that-
$68,000
And
at
that-
$20 an hour, cause you have the full
That is
pension.
their pay with the pension, with the
The
WRS,
pension
yeah.
and the health benefits, which I just estimated to be 14 grand a year, it's somewhere around there. I mean, that's back in the book, but,
It's helped that, those hours have been up to 1,200, they used to be 600. Fortunately for us, most of our staff was hired after 2011, so they were following those 1,200 hours.
but if they started in WRS anywhere before 2011, they followed under the old rules because of that.
Yeah. We currently have 2 staff that hit that, only because we have been here long enough to hit the 600-hour rule, but our ambulance calls went beyond 300 and 400 a year, it was easy to hit 600 hours, unfortunately.
So Alex, what are you saying, that there would be some more staff needed at approximate cost of like $60-some thousand?
If you are a protective service employee, or anybody that works as a WRS eligible employee, that's why you'll see job postings say cannot exceed X hours a year. Once you hit 1,200 hours, you now are a full-time Wisconsin retirement system
Vested
employee.
into the system.
Now that counts as being a full-time employee vested, so you get, since it's protective service, unlike a normal, I shouldn't say normal, but anyone not police, fire, EMS, they didn't get subjected to the Act 10, changes that they made in 2011 in state government.
I'll take your word for it.
We created an exemption when the bill was created,
Okay.
for various reasons. and
Can I
all proven
just
there.
stop you for a
So-
second?
so-
There is a
so-
motion on the floor.
Yeah.
I think we've been a lot of discussion to this, and I think this is all very important, but I think we're in agreement that we need a public forum. I don't know if any more discussion that we have right now is gonna make a difference right now, so I would just like to remind you of the motion.
Well, these are just some of the questions I would like answered, or
Right.
attempted to be answered ahead of the public forum, because these
Right.
are ones that will need some research.
That's what I'm trying to get
So
out
you're
of the way
asking-
now,
you're
are some
asking
of
how
the
we would
questions.
manage to keep staff under that 1,200 hours.
How you manage to keep it fully staffed 24/7 with solely part-time EMTs, managing the schedule that no one hits any of those thresholds to become full-time. Like, that's a risk factor, that's huge for this whole proposal.
Put that
And if
in
you,
there.
and what is your response if you are not able to get that many part-time at the hourly rate, willing to do the paid on call, on off-peak hours with the full pay on call? What is the contingency plan there? It's a huge risk to this.
As part of the original proposal, I want you to know that through the state of Wisconsin, you are given a 12-month grace period when you start an ambulance service. So we would actually have, at minimum, till the end of 2026, to be fully staffed. So in the meantime, you work with your mutual aid agencies, sign agreements with them so that they can back you up should we have an AEMT on this call and we need another call comes out, okay, or, whatever the case may be. So that's why I brought this forward now, to give us that year and a half to build up to starting this January 1st, 2026. I'm not proposing that we start this tomorrow or even next month, it's a year and a half. We have time to build up our staff, to get our staff fully trained. We are getting applications, I mean, as soon as this hit, the applications that started coming in were unbelievable, it's like this, like, we don't even have it yet, and they're still applying on the hopes that that actually happens. We've lost staff that have trained at the EMT level, here, we pay them to train, and then they leave us because we do not have our own ambulance service. So those are some things that.
Can I get all those? I mean, but I'm just going through some of the risk factors and seeing the
Yeah, well,
answer.
sometimes these people get trained all the way up and then get told to leave for no reason also. I mean, so you gotta weigh the benefit there. How many people are you gonna train all the way up and then say, sorry, we don't need
If
you?
you're gonna comment, sir, come to the microphone, give us your name and address, please.
John Bentley, 285 South Oak Road, Mosby. So, to Kronenwetter, whatever. So how many people are you gonna train all the way up? Firefighter, driver operator, EMT, and then never, make sure you have a medical record too, when we do all this stuff. Okay, cause that's why I couldn't run. EMS with Kronenwetter, because we didn't have a medical record at the time. Well, they didn't know that, but that's why. But yeah, I don't know if they're ready or not for it, so.
All right, so we got a motion and a second by discussion.
We have to move the motion for that. That's what she asked.
All that, I do ask that if you have questions that
Yeah.
you'd like me to bring back with.
Yeah, I'm just listing some of the major
Yeah.
points for everybody to think about, the assumptions on billing and revenue. 69% of our calls according to Riverside are Medicare and Medicaid billed, so below our full rate. I know there's a bill to equalize Medicaid and Medicare payments at 228. What are we doing about the 9% that are self-paid that could be high likelihood for bad debt? Riverside had 71,000 in bad debt last year. So if we have 28% of the bad debt on average, or if we have 20% of the calls, we have 28% of the bad debt, that's 21 grand. Contingency planning in the event of a staffing shortage, we went over. Continuing training that needs to occur to maintain our licensing for everybody, that everyone's still practicing skills they might not use all the time, even if they're at the level to be certified. Then this one for the planning, when you were speaking about it, there's a lot of burden you're putting on yourself and Alexa. What are we doing for the bus factor, the succession planning? Like, if anyone's heard of the bus factor?
If I get hit by a bus.
Yeah. What is the impact of the most critical person in the organization getting hit by a bus? You don't want you to get hit by a bus, but what is the plan?
Yeah. I'm very open with my entire fire department, they are all well aware of what we are planning, what we are working on. Would one of them be able to step up? I don't doubt it at all.
And then, of course, then just the easing in of the ambulance service. We have a year, as you mentioned, but we don't want growing pains on critical calls.
Correct. Agreed. That's why we are bringing this forward now and not next summer.
So those are my main questions.
Okay,
Yes, any questions?
yeah, I got, some clarification. Riverside bills at $5.50 a call?
No, their bill is much higher. It show,
I mean, to us, the village.
They bill us, the village, $50 per call.
So that billing,
So
to
that
clarify,
that 22,000,
That's $50 per call.
they only got 400 calls a year.
Depending on the year. We had 427 in 22, 408 last year. So it truly depends on the year. If you take 400 times 50, that's 20 grand.
Okay. Okay, so then what does Mosley get per call?
From who? That is what the
Well,
village
okay,
pays. That
okay.
is not what the resident or the patient is paying, that's what the village of Kronenwetter is paying.
as part of the contract.
As part of our
Like, we have a
contract.
fixed fee and then a $50 adder, and then Riverside takes all the billing over at that point. So they either,
Okay.
then they go through whatever insurance or non-insurance you have. So if you're Medicare, they get reimbursed at $511 a call. If you're Medicaid, they get like $428. So
Okay,
that bill
so-
passes, and then
So
blah, blah, blah.
the 200,000 that is going to Riverside is money that you're saying Kronenwetter would be getting?
Correct.
And that's from the insurance companies?
So
Okay.
they billed over $400,000 for those ambulance calls, 400 and some ambulance calls. They received 214,000.
Okay, but, so that's where I get to the 550, because if we got 400 calls and they're raking in, 200,000,
Yep.
or 220, whatever, that's the 550.
No, the 214,000 that they made on revenue that I showed on their budget is only from the building revenue. There's another line in there that says revenue from Kronenwetter,
You mean the $50 thing?
the $50 plus our per capita
Okay.
fee.
So, and Mosinee, their income from insurance divided by their calls is like 375. Okay, and that's,
Depends on their patient makeup. So the village of Kronenwetter is fortunate enough to have a pretty wealthy population for the most part. And when you have when you have patients who are insured, the insurance pays full pay in most cases, or the majority of pay. Not saying that we don't have our share of Medicare and Medicaid patients, because we definitely do, but they offset each other.
so, okay, and that insurance payment, does that change whether they're paramedic or EMT or AMT?
It does, so it's based on.
So is
skills
that why Mosinee gets less, because they're only?
Because they can only need EMT basic, correct. They are flexed to 8 EMT, but they cannot bill at that 8 EMT level.
Okay, I thought they could, as long as that was what their license was.
No, their license is EMT basic, that's what they can bill at.
Okay, and Riverside, their license is,
Paramedic now, in 2022, which is where I got the revenue from, their license was 8 EMT.
okay,
So even as an 8 EMT, you can still bill at the ALS 1 and 2 levels, depending on the skills that you use. So we would still be able to bill when needed, when necessary, at those higher levels. But it would be at a lower, but again, with Medicare, it doesn't matter if I bill $1,000 or $5,000, Medicare is only going to pay this much.
Well-
Medicaid is only going to pay this much. That's why I used true actual revenue that was projected and shown in a budget from 400 calls. This is what the revenue was, based on the makeup of the type of people we have in Kronenwetter.
Just got a quick question on the equipment too. Eventually, so once we buy these ambulances in the future, when we do have to replace them, where is the money for those? What was your intent of where that's gonna come from? Is it from just the equipment replacement fund, or was it gonna be from?
No, you can start building the equipment replacement fund on those. There are options with ambulances, so, I mean, the initial ambulance, brand new, 350,000. There are many options with ambulances. You can take the box off the ambulance, put it on a new chassis, which cuts that cost down tremendously. There are some that do it the opposite way. They keep their chassis and put a new box on it, just truly depends. So there are options for saving money in the future on those.
okay, well, I guess from my point of view, if, according to your numbers, if we're saving 9,000 a year, to me, it's not worth getting a $900,000 loan, and then the variables that Alex is talking about, and the other variables that we don't even know about yet, just to save this 9,000. And then we don't have to if we're getting a full, paramedic service now, then we don't have to worry about meeting them en route, or switch offs, or calling somebody, because they get the paramedic every time.
We don't, and I will make one adjustment to that. So if they come with an EMT basic and have to page out for a paramedic from their department, that's a second $50 charge to the village of Kronenwetter. Just as a side note.
And to clarify that, like I said, there's also a variable on what will Riverside or Safer or whoever RFP is gonna